Hi, this is Dr. Victor bringing you interesting highlights of ESC Heart Failure 2021, which is VerICiguaT in patients with atrial fibrillation and heart failure with reduced ejection fraction, insights from the Victoria trial. As we know, heart failure is associated with impaired synthesis of nitric oxide and decreased activity of soluble guanylate cyclase, which may contribute to myocardial and vascular dysfunction. By directly stimulating soluble guanylate cyclase independently of and synergistically with nitric oxide, VerICiguaT augments levels of intracellular cyclic GMP, leading to smooth muscle relaxation and vasodilation. Atrial fibrillation is common arrhythmia involved with heart failure and complicating factor for heart failure with reduced ejection fraction. The effect of some guideline-based treatment may differ according to whether atrial fibrillation is present or not. In Victoria trial, 45% had heart failure with atrial fibrillation, and the objective was to determine relationship of atrial fibrillation with outcomes of VerICiguaT treatment. The trial also assessed occurrence of new onset of atrial fibrillation post-randomization. The result showed that there was no association of atrial fibrillation with primary outcome, CV death, or hospitalization for heart failure in patients on VerICiguaT treatment. Over median follow-up of 10 months, new onset atrial fibrillation was seen in 10%. Among them, 6% had no prior atrial fibrillation and 18% had intermittent atrial fibrillation. The incidence of new onset atrial fibrillation did not differ among patients receiving placebo and VerICiguaT. Thus, the study concluded that nearly half of the patients with heart failure with reduced ejection fraction and decompensated heart failure had atrial fibrillation. Patients with intermittent atrial fibrillation had worse outcome with new onset of atrial fibrillation in less than a year. The beneficial effect of VerICiguaT was unaffected by any of atrial fibrillation at the baseline. Thank you.